right.
All right.
Mr. Chairman and Commissioners, some time ago you asked us to talk to you and have a conversation around what compensation meant and what total compensation is. And so Eileen has put together a presentation for us to begin this discussion. Eileen?
Good afternoon, Chairman, Commissioners. Eileen McNichol, your HR Director. You had asked for an advance copy and I did send it. I'm hoping that you had an opportunity to take a look at it and maybe jot some notes down. I would ask if you would to please make notes of any questions that you have and allow me to get through the presentation, and then at the end we would be able to have lots of dialogue and discussion. We're going to be talking about total compensation today and how it's a part of total rewards and how it affects our ability to attract employees, retain and engage employees, what it consists of, how competitive we are, and what our options are. Now, the mission for HR is to partner with divisions and departments to hire, to compensate, to support and develop a diverse workforce that's dedicated to delivering high-quality services to our community. And we do this by utilizing a total reward strategy, providing a positive employee experience through attraction, engagement, and retention programs and services. The components of a total reward strategy are compensation, benefits, employee development, and work environment. Now, here at the county, our strengths for compensation is our pay-for-performance philosophy. We are paying for performance, not tenure. Our areas of focus are improving our pay competitiveness, getting us closer to market, improving our scoring equity, and improving our pay pool funding so that we can differentiate performance. Our strengths under benefits is our plan competitiveness. Our plan is very competitive in the marketplace. Our areas of focus are engaging our employees to fully utilize the benefits that are provided so that they can get the best benefit from it, and educating them on consumerism so that they can understand the cost associated with their health care dollars. Under employee development, our strengths is the commitment by the county for employee development, that it's important. Our areas of focus are employee learning, supervisory competency development, and leadership development. For work environment, our strengths is the commitment of our employees and management to providing a good work environment for our employees. Our areas of focus are good hiring practices and results thereof, our new employee orientation and onboarding, an improved and increased effort for employee relations where we work with mediation and evaluating situations, our employee recognition programs, our employee experience surveys, asking them, how is your experience here, and then working on programs to make changes where needed. According to Aon Hewitt, a survey that they did, the top drivers for attraction, retention, and engagement, and this is what it's about when you're an employer, is for attraction, you need to have competitive base pay. You need to have competitive health care benefits and competitive retirement benefits and a good paid time off system. You have to have opportunities for advancement, and you need to provide challenging work. To retain employees, they need to have the necessary tools. They need to continue to have competitive health care benefits to help take care of themselves and their families. They need to have career development opportunities, and there needs to be clear career paths among the other things that are listed here. To engage our employees so that they are a viable part of the services provided to our citizens, there needs to be clear career paths so that they know there's opportunity for growth. They need to have the necessary resources to do their job. There needs to be career development and good teamwork. They also need to have the appropriate decision-making authority and a good understanding of their health care benefits so that they can get the maximum benefit from that. Another key to employee engagement is that employees need to have impactful, challenging, and meaningful work. They need to have an opportunity to do their job well and to feel good about the job that they do. But employees also like to be a part of something bigger than themselves in the organization, and that's where, as a public service employer, we have a competitive advantage. In 2014, we started tracking HR metrics. And in conjunction with these top drivers from Aon Hewitt, I've matched up our metrics with those functions, with those top drivers. For attraction, we're looking at time to fill and offers made to offers accepted. And what I've done with the attraction panel right here is I've color-coded it. Where you see green, that means that that's where we have good strengths. We're good in that area. Yellow is an area of caution, and when you see red, that's where we have issue. So when we talk about attraction, we do have the competitive health care benefits and retirement and paid time off benefits, which is going to allow us to have a shorter time to fill if we're doing that well, and also allow people to accept our offers, and we won't have to go to the next candidate and then the next. Our competitive pay, that's where we have an area of caution. Our reputation as a great place to work, according to our exit surveys, people do feel that it's a great place to work, and I think it's conditional upon the department that you're looking at. For retention, we are looking at turnover and retention itself. Now, I'll talk more in detail about turnover in a moment, but for retention, in our retention is almost 80% of our first-year employees, and that's very good. We're almost at 86% for our employees overall. Quite frankly, it's not too surprising because 61% of our employees have been here longer than 5 years. And the longer an employee is at an employer, the more connected they are, the more tied into things, and the greater the chance that they will leave, and they won't leave, and that they will stay and reduce that turnover. We have employees who have been here, 36% of our employees have been here over 10 years. Another thing that we look at for retention are our complaints and our investigations. Now, in 2014, we did a lot of investigations, and that was mainly what we did. And we started changing in 2014 to go more of evaluating our complaints and moving into more mediation of helping bridge the employer-employee relationship. And as you can see, in 2014, we had 15 investigations and the types of investigations that we had. And so far to date, in 2015, we've only had 3. The areas of concern that we are finding from these investigations and complaints are that people are not feeling that they have all the resources that they need. There's not enough help, not enough staff, that there's a little bit of a sense of not having that reliability in their work group, and there is a sense also of not being so much being people-oriented, and of course the stress associated with challenges with your coworkers. So in our engagement indicators, we're looking at absenteeism, and we're also looking at our employee experience assessment findings. We have done employee experience assessments for ComCare, the Sheriff's Office, and we're currently doing 911. What we have found under absenteeism that, and this is great news, for our employees in their first year, they've only been absent, an unexpected absence of FML, sick leave, or family sick, 2% of the year, and that's not bad. And it's 4% absenteeism for the rest of our employees. Now, there are some departments that have lower or worse absenteeism, but this is across the county. The areas that we're finding in our employee experience assessments are that employees are feeling that they're lacking a career path, and that there's not help in creating one, and also that they're lacking adequate resources and staffing help. But they do feel value in the work they perform. They feel that they're a part of a team, and that they feel that they're making a difference in the community. And as we continue in our new employee orientation, we've only been doing it for a month now, we will also have survey information on there. Yes, sir.
Eileen, if I can interrupt you here.
Sure.
And this may be my tired eyes struggling a little bit, but there is a bullet point.
Oh,
in
it
the
says
middle.
teamwork.
Is
Sorry.
that teamwork?
It's teamwork.
And is that considered green or another color?
That's green.
Okay, I just wanted
Green on blue, I'm sorry.
Well, no, it's hard to differentiate, and I wanted to make sure I clearly understood, and I'm
Yes.
glad to see. I thought it might be teamwork, but I wanted to
Yes, sir.
thank you, and sorry to interrupt.
No problem. The reason why we're using a total reward system is for optimization. What we're wanting to do is to get the right balance between cost management and talent management. We are looking at pay, benefits, employee development, and work environment so that it drives the employee behaviors that we want. We want employees to be engaged. We want them to stay. We want them to be very productive, and we want them to have an expertise in their field. We want them to have the sharpest skills they can have in the roles that they possess, which then feeds into allowing our citizens to benefit from that with enhanced public safety, satisfaction with the services that they're paying for, an advocacy for the county, and then community pride. That feeds back to us with citizen satisfaction and provides us that return on our investment in human capital. Now, I wanted to share some demographic information with you. At the end of 2014, almost 80% of our employees are under the age of 55. 73% of them are non-exempt. The concern there is with having the younger worker is it increases the chance of turnover. Even though they've been here a few years, the younger the worker, the greater the chance they'll leave. And that's why it's a concern that 80% of our employees are under the age of 55. Our performance ratings are, we have 20% of our population that are rated at a Tier 4, which is greatly exceeding expectations. The Society of Human Resource Management since 2002 has done a job satisfaction survey, and every year benefits, compensation, and job security have always been the top three. This last year in 2014, they added the question about respectful treatment of all employees at all levels and the trust between employees and senior management. How important is that to your job satisfaction? The first year they asked the questions, it went to number 1 and number 2. So in my looking at that information with the exit interview data that we have, it's somewhat aligned with our top issue of our employees, though they left, their satisfaction with their relationship with coworkers and peers, and their relationship with their direct supervisor, being 1 and 2. But benefits, very satisfied, even more satisfied than the average of this study. And again, with our compensation, that is an area where people are less satisfied. And job security was not an issue that we ask about. In our exit interviews, the top 5 satisfied categories, again, even though these are employees who are leaving, they're satisfied with their relationship with their coworkers, their job duties, their benefits, their relationship with their direct supervisor, their performance feedback, and their work-life balance that they're having. But the reason why they're leaving is because they're looking for a better career opportunity, because of pay. They have no opportunity for advancement. And when asked in that satisfaction part of the survey what they're dissatisfied with or strongly disagree is the opportunity for advancement, salary, and training and career development. So what they're dissatisfied with is the reasons why they're leaving. Now talking about turnover, our turnover rate, total turnover rate at the end of 2014 was 15.21%. And you can see voluntary at 13.62 and involuntary at 1.59. The areas of concern with that, based on our analysis, is that 43% of the employees who left had less than 2 years service. And 7% of the employees who left were our top performers. And the number that left was 9% of that top performer population. I took a look at the Bureau of Labor Statistics, and for state and local governments, turnover across the country was 16.4%, where we're at 15.21. But voluntary across the country is only 11.5, and we're at 13.6. Their involuntary was 4.9% because they included layoffs, whereas we didn't have any, and we're at 1.59%. The reason why turnover matters is because not only is it disruptive, but it also has cost associated with it. Typically, a lot of employers take a look at turnover cost and use 1.5 times a person's salary to determine the cost of turnover. If we did that for 2014, our turnover cost would be $24.8 million. There are a lot of intangibles in there, so we tried to make it more tangible, and we looked at things like overtime, additional shifts, on-the-job training, and loss of productivity, and came up with a number of approximately $24,000 per employee that left. When you multiply that out, it's $11.7 million. Now, an ideal turnover rate would be approximately 12.5%. We hope to get there over time. And this would be a voluntary rate at 11%, which would allow for retirements, relocating, people moving away, and career changes, and involuntary staying about the same at 1.5%. And if we were to get there, if we look at our more tangible rate, and we go from 15.21% to 12.5%, we could have a savings of over $2 million. Now I want to talk about total compensation in conjunction with total rewards. The total reward statement is the employee's experience at work. It's what they value in the employment relationship, the compensation, the benefits, the work environment, and career development. Total compensation is a subset of that, and it consists of their compensation factors of salary, overtime, shift differential, the benefits that it provided for them by the employer, and the financial security elements. This is what it would look like for us when we look at a sample employee, someone with our median income, which is $43,000, and they have 10 years of experience. The county provided benefits are their paid time off, and that would be what's equivalent at 10 years of service. The county paid family health insurance, dental insurance, life and accidental death and dismemberment, the county contribution to their flexible spending account, and then the taxes that are paid for CAPERS, workers' comp, Social Security. So when you look at a total compensation for an employee, a $43,000 employee has a total compensation of over $75,000. And that is the thing that we are going to be working to help our employees understand. There is more to their compensation than just their pay. We wanted to look at our biggest government competitors, so we looked at the city of Wichita and Johnson County. And what you're seeing in the dollar signs are the median income, meaning the amount of pay that is right smack dab in the middle from the highest to the lowest. The percentage amounts are the percent of their total compensation for their pay, and the red is benefits, and the green is the tax percentage. We are behind, number 2, we're behind the city of Wichita in pay, but our benefits percentage is stronger. Johnson County has a very rich plan. They are nearly 50% pay and 42% benefits. When you look at it on an hourly or a dollar figure, our total compensation equals 36.4 cents an hour. Wichita's is 39.47 cents, and Johnson County's is $40.84. So as you can see, we fall below both of our big government competitors. Let's talk about our compensation component of total compensation. As you know, in 2014, we undertook the Evergreen Study, and with that we developed our pay philosophy, that we want to have a pay system that allows us to recruit and retain competitively. We want our pay midpoint to be at market, which is the 50th percentile of the pay scale. And we start people at minimum, and currently the way we're doing it with a pay pool of 2.5%, it would take someone about 10 years to get to market. The best practice is 2 to 5 years. And we also want to maintain and achieve internal equity. In the study, we benchmarked 72 positions, and the findings were on average that we were 6.7 below market based on midpoint of the pay range. And based on our financial constraints, this is how we implemented their recommendations. There were 5 pay structures. We compiled them into one. There were 36 pay grades in the one pay structure with a 5% progression between grades. We grouped similar job classifications and then adjusted the bottom of the pay structure by 3.35% and then had a 5% progression up from all the other pay grades. The employees who were in new classifications that were below the new minimum, they received increases to take them to that new minimum, and all the other employees who were below the minimum or were above the minimum of the new range were given a 1.26% increase. We were also advised to regularly conduct a mini survey looking at the market values and benefits to make sure that we were maintaining a sense of our competitiveness. And based on the low response rate we've been getting from our partners, we are now using a new tool that's being provided by the Kansas Association of Counties. They are having an online salary and benefits survey data, which will allow us access to a lot of good information. So for our compensation discussion, I wanted to provide you the continuum of the pay strategies, the advantages and challenges that we face from going from a flat bonus where you would not compound salaries to a market equity adjustment. So when you look at a flat bonus, not compounding salaries, the advantages for the employer are you have a fixed expense and you have a one-time annual cost. It could be spread out over the year, but it doesn't have to be. The challenges to the employer is that there's no mechanism to get the employees to be paid at market in our current structure. There's also salary compression issues, and it has a negative impact on CAPERS. People's salaries are not going to be increasing, and so as they get to a point of retirement, they will have a more flat salary structure from which the final calculation will be done. It also affects our ability to attract and retain employees, and employees have no control over the amount of income they might get, and they would be taxed at a higher rate because it would be a bonus, even if you spread it out over the year. The difference with going to a pay-for-performance bonus where you don't compound salaries, again, or you have a fixed expense, and the advantage is that it does match job performance, so that matters. And employees can control that based on their pay, based on their performance. But the rest of the challenges are true. Just like they were before with the flat bonus, there's no mechanism to get employees to be paid at market. We still will have salary compression issues, the negative impact on CAPERS, and our inability or our negative impact on attracting and retaining employees. The next one up the continuum would be to put back in place a step plan. The last one we did was in 2008. The advantages of that is that it's easy to understand, and it eliminates the perception of favoritism. The challenges are there is a higher cost by salary compounding, there's still salary compression, and it focuses on tenure, not performance, and you will run the risk of losing more of the high performers, and again, attracting and retaining employees. The next step up is a cost of living adjustment. The last one we did was in 2004. The advantages are, again, it's a fixed amount. There's a slower cost increase for the organization. The challenges are there's a higher cost by salary compounding. There's still salary compression issues. The employees have no control over the amount that they would receive. And there would be the challenge of retaining employees because there'd be no focus on performance. The next step up is what we're currently doing. We started doing this in 2009, and that's the pay for performance where we do compound salaries. The advantage is there is a focus on performance, and it allows us to retain high-performing employees. The challenges are it's a higher cost by having the salary compounding. We still have the issues of salary compression, and we have the issue of properly funding a pay pool to differentiate performance. And then we have scoring inequities that we're currently trying to address. The last step of the continuum is doing market equity adjustments. We addressed this a little bit in 2014 when we did the Evergreen Study. The advantages are paying employees at market. They would feel fairly compensated. It would allow us to have a stable employee base and allow us to retain high performers. The challenges are there's a higher cost with that, especially if you do pay for performance. You would have to make adjustments in our ranges and individual adjustments to address compression issues. But aligning it with our strategies, the market equity adjustment definitely aligns with those pay strategies. Pay for performance with compounding salaries takes 2 of the 3 of our strategies, but again, we're still below market, so we're not able to align with that one. So now, let's look at health benefits. We have 3 goals with our benefits. One is to offer a locally competitive benefits package. That will allow us to attract and retain the employees we want. We are utilizing recruiting materials to highlight our benefits packages. We have enhanced our new employee orientation with benefits information, providing much more information than we ever have, and providing regular communications highlighting the components and advantages of a benefits package. Our second goal is to encourage employees to take responsibility for their personal health. We're going to be doing this by increasing their awareness of the importance of personal responsibility, by promoting how our county benefits help enhance the quality of their life, both physically and financially, and provide programs that focus on chronic medical conditions. The first week of June, we are going to be starting our diabetes prevention program, which is a screening program allowing people to determine if they're pre-diabetic, which will help people avoid going into diabetes. And also promoting other United Healthcare programs such as Refill and Save, which gives people cash back when they continually refill their prescriptions, which is a good thing, and other programs like smoking cessation. And provide information to encourage healthier choices. We're going to be doing this by analyzing our plan utilization data, providing that kind of information in context of how it impacts them, and sharing success stories. And our third goal is to reduce future increases in benefits cost. We're going to be injecting consumerism into decision-making processes for healthcare by educating our employees on how to be a consumer of healthcare. And also, as I said, to do our plan utilization analysis, to educate our employees on what that means and how it impacts them. And, if necessary, to make plan designs, because we have the access to our information and being self-funded, we have the right and the opportunity to make changes. And to promote well-being initiatives. United Healthcare provides us a $50,000 credit that we can use to incentivize people to make healthy choices. We're going to be using part of that money in our prediabetes screening. And then also to communicate other resources and tools from our vendors. In our benefits book, we have two goals in there. One is the diabetes prevention program completion rate. It's important. We have 300 slots, and currently right now we have 50 people who have signed up for it. We need to make sure we can help and provide opportunities for people to determine if they are at risk of getting type 2 diabetes, because with that there's other complications of heart disease, stroke, eye disease, amputation. So it's very important for people to avoid diabetes if they can. The second one is our adherence of medication for associated chronic conditions. The chronic conditions are diabetes, arthritis, heart disease, stroke, cancer, and epilepsy or seizures. So our continuum for our health benefits plan, and this is looking through two different lenses. The first one will be the employer's lens, and the second one will be the employee lens. For an employer, you go from no coverage, you don't have to provide coverage. There's no law that says that you have to do that. Benefits were started back during World War II, when employers had a very difficult time of getting people to come work for them because unemployment was so low, and there were restrictions as to what employers could pay. But once the Labor Board determined that fringe benefits, such as time off and health insurance, was a fringe benefit and not a part of pay, it allowed employers to entice people to come work for them. So it's during World War II that employers started providing health insurance benefits. So you don't have to provide it. There's no law that says you have to. However, the Affordable Care Act will penalize you if you don't. So the advantages for the employer to not offer any coverage is that there's no claim costs to deal with at all. You're completely out of the benefits business. The challenges are that you are going to be subject to those Affordable Care Act penalties, and employees may forego care, and that will potentially increase our absenteeism, which will be a problem. And of course, attraction and retention would be a problem with that, because currently benefits are an expectation of employees. If you move up to an employer-defined contribution plan, the advantages for the employer are there's a set amount of money that you provide to employees. And you have no health insurance costs, no premiums or claims that you have to deal with, and you get a tax savings for providing that contribution. The challenges are, again, you are going to be subjected to the Affordable Care Act penalties, and you run the risk of employees foregoing care and the retention and attraction issues. The next step up is a high deductible with a health savings account, whether you have it as a standalone plan or you add it to our current plan. If you add it to our current plan, the advantage for the employer is that your employees are going to have choice, and that's a good thing. Also, when you provide a high deductible health savings account plan, the employees pay 100% of the cost for their health care up to a high deductible. The challenges with a high deductible and health savings account is, again, the retention and attraction problem, and that your members, your employees, may forego care, which could cause much higher claims cost. If we were to add a health savings account and a high deductible plan to our current plan, we would have to redesign our current plan so that it would be viable for people to choose to go to the high deductible health savings account. The next step up is where we were last year, which is being fully insured. The advantages for an employer is that you don't have any claims costs. You don't have to mess with that. The insurance company handles all of that, plus all of the legal and compliance issues. The challenges for the employer with a fully insured plan is that you have no control over plan design. If you want to change something, you can't because it's not your plan. Also, any claim savings that there might be seen are kept by the insurance company, and you may be paying more than you have to. And you also would be subjected, usually each year there would be an increase based off of claims experience and administrative fee experience. And then that leads us to where we are now, which is being self-insured, our current plan. The advantages are that you get to review the claim data to evaluate and make any plan design changes that you want. You are paying for actual claims, and if there are any savings, you get that money. You are only paying for actual claims and the administrative costs. You also provide, you take out stop-loss insurance to help mitigate those high claim costs. And the challenges are, though, you are going to be managing the risk and the legal and compliance issues, and there's also claims cost fluctuation. Now, if you look at it through the employee lens, the advantages of no coverage is that they get to choose whatever plan they want, and should they leave an employer, they take that plan with them. The challenges of no coverage is that there's no employer assistance to help provide health insurance coverage. They've got to go out, get their own insurance, and figure out all of what that means. And because of that, they may get a plan that will not provide them very good coverage, and it may mean that they will forego care and be subjected to higher health care costs. With an employer-defined contribution, the advantages for the employees is that, again, they'll have choice of whatever plan they want, plan portability, and with an employer-provided set amount of money, then that will help offset the cost of their health care insurance. The challenges are, again, they've got to go out and find their own insurance, they have to figure out how to manage it, and they may forego care. If provided a high deductible and health savings account, whether standalone or added to our current plan, they have choice. And the thing that's great about a health savings account is that the health savings account funds roll over from year to year. There's no minimum balance restrictions. They can have as much in there as they want to. It's like a 401k. It's a retirement plan. The health savings account funds are portable and tax-free. Expenses are covered at 100% after you meet out-of-pocket max. What that means is when you have a high deductible plan, you have no copays. So once you have hit your out-of-pocket max, you're done paying. It also is it's proven to be a very acceptable solution for healthy and financially stable people. The challenges with a high deductible health savings account is sticker shock. The employee pays 100% up to the deductible. And when you're used to paying $30 for a prescription and now you're paying $230, that can be a bit of a sticker shock. There are no copays, just coinsurance once the deductible is met. The high deductible is there, and once you have to meet the high deductible before any insurance pays, and that's something that employees aren't used to either. There can be a financial hardship for unexpected health care costs before you reach your out-of-pocket max. If you don't have enough money in your health savings account, You can't use money like with a flexible spending account. You say you're going to put $2,000 in it. You can spend $2,000 on day one. With a health savings account, you can only spend the money that's in there. So if you have a health care cost that exceeds what you have in your health savings account, you'll have to come up with that money somewhere else. There is an annual maximum contribution restriction from the IRS. You can only put in so much money a year, but over year, it can be as much as possible. There's no restriction. You can only use it for qualified dependents on your tax return. If you have children that are not your dependent, but you still have them covered on your health insurance, you cannot use your health savings account to pay for their health care costs. If you take out any money, you can go to an ATM and swipe your card for a health savings account, and if you take money out for a non-qualified expense, you'll owe taxes and penalties on it if you're over the age of 65. And again, if people don't have enough money in their health savings account and they're on a high deductible plan, they may forego care, which could cause higher claims costs. The next step up is our former plan, and for an employee, the employer provides it, so that's the advantage to them. The challenge is for some employees to be able to pay the premium, the deductibles, and out-of-pocket max. And the same is true for a self-insured plan. For employees, it doesn't matter if it's fully insured or self-insured, there's really no difference. So in alignment with our 3 goals for health benefits, you can see that for self-insured, it meets all 3 goals. For adding a high deductible health savings account to our current plan, it almost meets all 3 goals, except with a caveat that possibly employees may not be, they may forego care, which would cause an increased cost in claims, which would not meet the 2 bottom goals. So our costs on the continuum of health benefits plans, which are very important to note because of the Affordable Care Act, and because with a high deductible and health savings account, it's regulated by the IRS. If we were to provide no coverage to our employees, there would be Affordable Care Act penalties of over $5 million, and there would be potential additional penalties of over $3,000 a year per employee who might go to the public exchange and receive a subsidy. With the employer-defined contribution, the same penalties are true, but add to that the cost of the defined contribution that you want to give. The next step up being the high deductible and the health savings accounts. There's the cost of the insurance that you would providing a high deductible health plan. And then these are the restrictions that are restricted by the IRS for a high deductible health savings account. There's a minimum deductible. The minimum is $1,300. And what's interesting is our current deductible is only $1,000. The out-of-pocket max, the maximum that you can put for an out-of-pocket maximum is $6,550 for single coverage or $13,100 for family coverage. And the maximum that can be put into a health savings account per the IRS is $3,350 for a single person coverage or $6,750 for family coverage. And again, there could be some potential penalties for the Affordable Care Act if this is determined not to be affordable care. And then there would be the amount that if we decided we wanted to contribute to their health savings account, there would be that amount. The next one up would be fully insured. And the information I've provided here was when we were fully insured, we had our premium costs in 2013 and 2014, and those are the dollar amounts that you're seeing there. That's what we paid in premium, but not in claims. Being self-insured, again, all we're paying is administrative fees and claims, and those claims are both medical and prescription. And we also have that stop-loss insurance that I was talking about. We've budgeted over $30 million to cover those expenses, and in our first quarter, we've only spent $4.2 million, which is 45% below the budgeted amount for the first quarter. Our options to help keep healthcare costs down, where we are now and what we're doing now and just starting is to help reduce our claims. And we're doing that by focusing on medication adherence, chronic disease management, prevention and wellness efforts, and education and consumerism. The next step up from that would be to look at cost share adjustments in premiums and co-pays, co-insurance, possibly putting in a spousal surcharge, not covering certain dependents, having a cost share difference in deductibles and out-of-pocket maximums. And then the next step that you would do would be to look at plan design changes. Do you want to add different coverage changes, different options, add a high deductible health plan with a health savings account? So these are the different options that you have in help keeping down healthcare costs. We also wanted to provide a claims cost history. Now these are actual claims. And keep in mind, please, in 2013 and 2014, we only paid premiums. We did not pay for claims directly. These are the claims in the months that they were incurred. And we're looking at that so that we can compare it to where we are now with our self-funded plan per month. The information is for our 2015 claims cost is as of May 15th. And we feel pretty solid about the data for January and February, that it should be mature enough that it captures all the claims that hit. But March still may be a little immature. There still may be some claims yet to go into that category. You'll notice that from 2013 to 2014 there was a 2% increase in claims cost. But when we were paying administrative costs, when we were fully insured, there was an 8% increase in the administrative costs between 13 and 14. It's our hope that with our total compensation correlation, if we can reduce our claims, then that would allow us the opportunity to look at adding some money to our pay pool. And these two graphs are just to show that if our claims were to go down 5%, our pay pool could be increased to 3.4%. If our claims went down 7.5%, our pay pool could go to 3.85% without any impact on total compensation. If we had a 10% drop in claims, we could add to our pay pool, so it would be 4.3%, and that would be without adding anything additional to our 2.5% pay pool. The next information that we wanted to provide was a historic perspective of how our personnel costs have changed over the past 5 years. The first chart you're looking at is the dollar amount, the blue being our pay, which is our base pay and shift pay, the red being our health insurance, the green being the pension costs, and the purple being all other. That's overtime, county taxes, and other benefits. That is the increase, and as you can see, pay has decreased where the other costs have gone up over the past 5 years. And this is the information in a percentage format. Pay has gone from 71% in 2010 down to 66% of total compensation in 2014. And of course that was due to the fact that we've cut a number of full-time equivalents. Everything else there's been an increase in. So as you review the options for total compensation, there are some considerations you need to take, and that is for a flat bonus, and that would be where we would not be compounding salaries, we would need to have a method to pay to approach market levels. If we go with a flat bonus, everyone will be stuck where they are. And currently, we have a great number of employees that are below market. 60% of our job classifications currently are still below market, even after the Evergreen Study change. We also would need to have a plan to effectively recruit, retain, and engage employees. The same would be true for a pay-for-performance bonus pool, not compounding our salaries. We would need to increase the pay pool size to make sure that we could provide true pay differentiation based on performance. And we would also need to figure out a method to get people to approach market levels. And we would need to make sure we have a plan to effectively recruit, retain, and engage employees. With a step plan, we would need to create a new plan, and we would need to determine how we would motivate employees, because this step plan would focus on tenure, and we would run the risk of losing our high performers. And we would need to have a plan to, again, effectively recruit, retain, and engage. If we used a COLA, We would need to determine how to motivate employees, because this would be focusing on market factors and not performance. And again, we would need to have a plan to effectively recruit, retain, and engage employees. With our current pay-for-performance process, where we are compounding salaries, we would need to look at having a pay pool increased so that we can show a true differentiation based on performance. The pool we have now is such that there's not a lot of differentiation between a 1 performer, 2, 3, and 4. If we go with pay equity adjustments, we would need to have a vast amount of money to do that, because there's $2.8 million that we would need to do the rest of the Evergreen Study, and that dollar amount is 2 years old, so it would be a tad bit higher than that. We also would need to have additional funds to mitigate compression concerns, and we would need to revise our policies so that employees could be hired at levels that are equal to their experience, not just starting everyone at minimum. For the health insurance plan considerations, if we were to provide no insurance, we would need to cancel our contract with United Healthcare, and we would need to have significant lead time for employee education about health care market options and the personal purchasing of insurance. And employees would have a higher cost for insurance coverage. And again, we would need to have a plan to effectively recruit, retain, and engage employees. If we did the employer-defined contribution, we would have to cancel the contract with United Healthcare. We would need to determine what type of contribution formula we wanted to use. We would need to have significant lead time for employee education about healthcare options and about going out into the market and making those purchases, with the understanding again that employees would have a higher cost of insurance coverage, and that plan to recruit, retain, and engage employees. If we add a high deductible and health savings account, or only have the high deductible health savings account, we would need to work with United Healthcare to make plan design changes. We would need to determine if there was going to be an employer contribution for the health savings account. We would need to have significant lead time to educate our employees about the advantages of a health savings account, and to revise our methods for recruiting, retaining, and engaging employees. Our current plan, our considerations are that we need to determine, based on our claims utilization, if there needs to be any change to the plan, and we need to review this annually to see if there should be any cost sharing of premiums, deductibles, or out-of-pocket max. Our United Healthcare contract ends the end of December 2017, and at that time we would need to decide if we want to continue that contract or look elsewhere. So in summary, total rewards are what employees value in the employee relationship of compensation, benefits, employee development, and a good work environment. Total compensation is a basic and critical part of total rewards and the employee experience for attraction, retention, and engagement. And so for total compensation, we here at the county, we're very strong in our benefits competitiveness, but we are lacking in our compensation competitiveness. I would be very happy to answer any questions that you have. My intent was to provide information. I know I provided a lot of it.
Commissioner Peter John.
You certainly did provide a lot of information, so I appreciate that. But one area where I was looking for more information, and because of our unique nature and structure as an organization, we've got some departments that have higher turnover and higher retention, or you could put it the other way, by department. Is there anything that you can kind of provide to help in terms of, are we in better shape as of May 27th, 2015 overall, looking at, I shouldn't say overall, but by department, is there anything that we could tell if we had the department data that's missing when we look at the entire county as a big picture?
The areas where we have the highest turnover are with the treasurer's office, with the fiscal associate, the corrections worker, ComCare senior social worker, and the ComCare case manager 2 worker, and also the sheriff's detention deputy. There was a focus on some of these efforts with the Evergreen Study, and the minimum salaries were increased, and that helped a bit. But specifically for the treasurer's fiscal associate, we have a higher turnover this year than we did last year.
Despite it giving them additional
Yes.
compensation. Interesting.
The feedback that we've gotten from some employees, as just anecdotally, is that there seems to be a sense of rigidity in some of the departments, a bit of top-down management style. They don't have as much autonomy or the sense of being able to make decisions as they would like. There's a little bit a lack of empowerment.
Let me ask kind of a variation off my previous question. If we've got certain departments that have higher turnover, is the comment that we have lack of ability to advance, is that a major problem in those departments, or is that unrelated?
I think it's related. I think there's an issue of pay. Based on the exit interviews, we get about a 50% turnover response from our exit interviews. Pay is a very big factor. Lack of advancement, lack of career development. I mean, they see nowhere to go. They're just stuck. And so I think that, coupled with a little bit of that intensity in their work environment, causes them to go elsewhere.
Okay. Thank you.
Commissioner Howell. Sorry. Thank you, Mr. Chairman. I have a number of questions for you, Eileen. Thank you for the good presentation today. It seems, we were looking at the budget presentations the other day, and I did happen to notice that the ratio, I would use the word ratio of actual salary versus total compensation. So looking at the total amount that it costs the county to have that employee, ratio seems to be, in some cases, almost 50-50. In other words, 50% of their overall compensation is benefits. And it just seems to me to be a bit of a, says a number of things to me, I guess. Maybe their salary is just so low and benefits cost. There's fixed cost in there that you just can't get them any lower. And so that maybe that's just the way it has to be. But is there some type of a benchmark ratio that we ought to be looking at? It says that for an employee of some level, that a ratio of total compensation ought to be salary versus benefits.
When we did the Evergreen Study, the findings that they came back with, and when they looked at our competitors, their benefits ratio was about 37%, where we were at 31%. So we seem to be a bit low of our competitors. But to answer your question about a specific ideal ratio, I'm not sure that there's a formula that says what it should be. I think it's kind of like, what's the value of something? It's like what you're worth, what you'll pay for it.
And you say 31%, but that would be probably true for the higher salaried people.
Correct.
But
That's
if you're
correct.
lower salary, let's say you're
Right.
making something that's in the $30,000 range. My guess is it's upwards of 50%.
Yes, you're right. That would be,
Right.
and that's the benefit of helping someone see their total compensation.
Do you send out a statement once a year or anything like that to let them know?
That is one of the things that we're looking to do in 2015.
Okay. I noticed that you didn't really cover anything about. I think there is some program out there, but I don't know much about it, called tuition reimbursement.
Correct.
Do we have any visibility to that during this process? Because I think that for advancement, if these people have an opportunity to go to school, that might give them opportunities to be more qualified for positions that might show up. So
We do have a $35,000 tuition reimbursement program, but it's limited to $900 a person. It helps a little bit. We have very, very low participation rate in it, 4%.
it's $900. Is that per year?
Mm-hmm. Yes, sir.
Okay. So the total cost of the entire program for the entire county is $35,000.
Correct.
That does seem very low to me.
Yes. It would be nice to be able to utilize those funds to provide employee education more specific to their job and helping develop them in that.
Well, to the extent that we're supporting Wichita State University and NCAT, WATC, it seems like we ought to be trying to negotiate some type of a deal with them for our employees.
That's a very good idea.
I think that's low-hanging fruit, in my opinion. You make a couple of comments on slide 45. You say that the employee will have higher cost for insurance coverage. Can you please explain that comment?
Sure.
Because the whole point of an HSA,
Did you say slide 45?
slide 45,
Okay.
the whole point of an HSA is you're buying high deductible insurance, which means your cost of insurance is actually lower, but your out-of-pocket could be higher if you have claims. Go ahead and explain the comment before I go any further. It says the employee will have higher cost for insurance coverage. What do you mean by that?
If they have to go out into the private market or the public market, they can have $4,000 a year of annual premiums and high deductibles and high out-of-pocket max. That's what I mean by that.
Okay, but in doing that, and by the way, I guess if we were to go this direction, I would expect we would have some recommended, products that they can consider, and maybe we negotiated group rates as well. So it doesn't mean that you couldn't have negotiated group rates, even though it's a high deductible insurance plan. They would have to make the choice to participate in that. But if it's an HSA, they've got a bank account, so to speak, that they're paying that out of. So it really isn't coming out of their...
Well, they can't pay premiums out of their health savings account. They can only pay medical expenses.
Okay, I think you just lost me there. So
sorry.
When my understanding of HSA is that the employer pays into the HSA account that's owned by the employee.
Yes, they can.
And
they don't have to.
So the employer's paying into that, and the employee can pay into it if they want to. Correct. Out of that account, they pay for their premium.
No, they cannot.
They cannot.
They cannot. They can only pay medical expenses, going to the doctor, the pharmacist, the dentist, up to, they have to pay 100% of that cost up to the deductible. Once they hit the deductible, then they can go into coinsurance where they split the cost of it until they hit their out-of-pocket max.
Okay, I'll do some studying on that. Maybe I'm completely crazy on that one. That's fine, but let me go do some work on that one and
Sure.
come back with you on that.
Just a clarification.
Sure.
Slide 45 is employee defined contribution. Isn't there a difference in that in the health savings account?
What do you mean?
Slide 45, where the statement says employee would have higher costs for insurance
Oh.
coverage, that's under employee defined contribution. The
Right.
health savings account's about. So
Correct.
I just want to know, is there a distinction?
Slide 46.
Right. If you can do an employer contribution and give the employee a set amount of money for them to get insurance, and the way that is done typically would be the employee would go get the insurance and we would reimburse them.
Okay, so maybe I should be talking about slide 46 then. So for HSAs on slide
Right.
46,
Health
then,
savings accounts. Okay.
it's more like I described them. They would, out of that account, go and purchase an insurance product. They can't do that.
No, sir.
Okay. I'll go do some work on
I put together a health savings account fact sheet that I can leave with you.
Okay.
But certainly do your own research on that. Yeah, it's restricted to what you can do with it. But the benefit of it is that it is portable and it grows over time. It's just like a retirement account. But you
Right.
can't use it to pay premiums. You can use it to pay co-pays, co-insurance, deductible cost, but not premiums until you reach 65, and then you can.
Okay. All right. I'll work on that one, as I said. Is there some correlation between salary levels and retention percentages? In other words, the people who are making, let's say, $30,000, they have a high turnover rate, and those that are making 50, 60, 70,000, they're not.
We have not done that analysis, but I would say that the closer someone is to market where they feel like they're fairly compensated, if they're working in a good work environment, the chances of them being retained is very high.
It'd be interesting to see some analysis on that.
Okay?
And I guess where I'm going with that, I'm going to just share this with the room, and y'all can take it and chew on it. tell me what you think about it. But at the state level, we came up with a scheme. I'll use the word formula to try to bring up the people at the low end, because we recognize that was really where our retention problems were. People making $100,000 a year rarely will walk away from that type of a job, and they don't. If you do a percentage increase for someone making $100,000, that's a fairly healthy increase, and someone who's making $25,000 is not that much. And so, trying to recognize that and how retention ties into this, we created a formula. So if you're low income, they would get a higher percentage. If you're high income, it's a lower percentage, maybe even zero. And it was basically a y equals mx plus b formula. So there was a b, which is a base value, and then a formula, basically a slope between two endpoints, if you will. And I helped develop that, and it was intended to correct without creating compression, or without creating steps where someone, say maybe someone's been there for, say, 5 years, and they haven't had very many raises, and someone else come in kind of below them, and because they were jumped up quickly, now they're basically level with each other. Trying to avoid that type of situation. So the formulatic solution to that would be something I'd be interested in talking about more.
Okay.
So I may be able to visit with you about that specifically about later on.
Okay.
I think I had a couple of other questions here. I'll let somebody else talk for a minute while I find my other questions. Thank you, Mr. Chairman.
Back on slide 46, one of the options is a current plan, high deductible with an HSA. So that means we'd have some coverage that we would do, but they'd have a high deductible. Do you know how high?
We would have to determine.
But then we'd have the health savings account to help offset that high deductible.
Yes.
Is what it would do.
Yes.
I mean, this is something. I know I've asked about this in the past about getting a higher. I've had this suggested that we could save money by getting a high deductible, and then even if we paid the difference in the current deductible and the higher deductible was what I was told. So it wasn't necessarily in the context of a health savings account, but there'd have to be some analysis. Like if you raise the deductible from $2,000 to $4,000, let's say, and we agreed to pay that $2,000, it still might save us some money. I guess it depends on what the deductible goes, and there's some analysis that could be there.
Currently,
it needs to be done. And
right, a lot of analysis for that. Currently, 4% of our covered employees and covered lives have met their deductible, and many are getting close to meeting it at 5 months. That's not very much. That's not very high. So we have a lot of people using the copay, and that is, copays don't go towards deductible. When you have a high deductible health plan, copays are not a part of that. So people are paying the real cost of things, and that's where that benefit comes in, that savings benefit. They would meet their deductible much more quickly if we didn't have the copays, that if they were not utilizing the copays. But the thing that's good about a health savings account is people who are financially well off and unhealthy benefit from those greatly, because they can meet their out-of-pocket max fast. But that doesn't mean they have to have the money in the health savings account. People who are not healthy and not wealthy have a difficult hitting the amount that they need in their health savings account to pay for that health care. That's a challenge. The other group of people who go for a health savings account are the healthy people. And
well, that's what I was going to say. Regardless of you're wealthy or not wealthy, if you're healthy, because you can save that money over time,
correct.
And
that's a benefit.
Happens, you have it.
That's a benefit for them, but it really doesn't do anything to help us because they aren't turning in any claims. It's just such a.
I think the benefit comes from the high deductible.
But if they're not turning in any claims, there's no cost to us, there's no cost to them. They basically just have another retirement plan for their health savings account. And I'm not saying that's a bad thing for them. I'm just saying it doesn't help us keep that cost down. Because people who have health problems and not a lot of money are going to go with the copay and go with the employer assistance.
Okay, but this says the current plan with a high deductible, a health savings account.
That would be providing them the PPO plan like we currently have, and then a high deductible with a health savings account. And we would have to redesign our plan so that it was attractive, it was make it viable for people to want to go to that high deductible health savings account. And we can do that. It's not that we can't do that. We would just have to look at where those points line up.
Well, why do you say it wouldn't help us? Wouldn't it help us in the future growth of our expenditures?
Help us in the future what?
Our growth expenditures, I mean, the growth in the healthcare expenditures?
It depends on who goes in there. If people can go in there and they feel that they can put enough money in their health savings account so they can pay for those expenses, then definitely that will help offset our claims cost for those people. But people who don't have the means or the wherewithal or the desire to put money into the health savings account enough so that they can protect themselves against high claims, they would probably stay in a plan that would pay them they would have that cost sharing of the copay where they pay $20 to go see the doctor, get a $15 prescription.
They would have the option between the two.
If you were to design it that way.
I'm thinking they wouldn't have the option, but with the health savings accounts, we would put money into it.
Yes, but
Right.
but it's limited. You can
It is, but
right. You can only put in
$6,000.
$3,000. Let me get
Six
that.
for a family.
Okay. Well, let me.
And that is an issue which we need to put on our federal legislative issue,
But
there's a lot of moving parts.
There are a lot of moving parts. And the thing typically that employers do is they'll put in half of the amount of the deductible. That's their contribution.
Well, what do we pay on average per employee? What's the annual cost?
Hold on, I got that. The county pays for single coverage annually. The county share of it is $5,271. For two-person coverage, it's $10,542, and for family coverage, it's $15,285.84
Okay, but I
per
mean,
person.
what's the average for overall? If you took all the amount we,
Oh,
do you
okay.
have that? It's somewhere between 10 and 15,000. Then is that right? Total expenditure divided by the number of employees. I'm just trying to get the average.
Well, it's interesting. We have about a three-way split between individual, two-person, and family. That's kind of interesting. And currently now, we spend over $1 million a month for individual coverage and $2 million for two-person and $3.4 million, almost $3.5 for family coverage monthly. That's our share.
Okay. Well,
Did that
Can you say
answer
that
your
number
question?
again? What was that number again, please?
For individual, we spend $1.1 million. For two-person, it's $2.1, and for family, it's $3.5.
Thank you. Sorry, didn't mean to interrupt you. Go ahead. Interrupt you.
well, I think really to make a good informed decision. I mean, I'd like to see this have some discussions with United Healthcare just to see. I mean, they got to know how these work and can show
They
us
have
some different.
They have a number of
I mean,
clients
about-
that have a health savings account currently. They are familiar with that.
They could kind of show us with different scenarios what the cost would be. Okay.
You know, these insurance companies, they have these actuaries or whatever. They take a group our size and figure their numbers and say, this is what it costs. How much is the county going to pay? How much is the employee going to pay? And you can do all this hocus pocus, but the only way we're going to reduce county costs is to have the employees pay more. the general cost is going to be the same. You're not going to be able to do much manipulating with that and come up with some magic formula that is going to save the county money and save the employee money, and we're all going to get more health care. It doesn't work, guys.
One approach is to help reduce claim cost. And the approach
Yeah,
that we're
you can do
taking
that.
now, being self-funded and trying to impact and reduce claim cost, that is one way that you can reduce that cost.
And to get someone in to take the steps necessary to reduce their health care, that costs us a little bit of money too. But my point is that there is no magic answer. A
No.
group this size with this age makeup, the health insurance people have got it figured down to a gnat's eyebrow, and we're either going to pay so much and put it on the employee, or we're going to pay less and put it on the employee. And the differences in there are pretty minimal. I mean, you can make a little modification, but it is not much of a modification.
And again,
that's the way it is.
That's right. And depending on what is decided by you gentlemen, that's going to impact our ability to attract, retain, and engage. And that's, when it comes to employees, that's the bottom line.
Commissioner Peter John?
Let me ask a variation, because in terms of attracting and retaining due to health care, and since we've now moved and shifted from the fully insured to the self-insured, I'd like to try and get a better understanding in terms of, what percentage of our total full-time employees are utilizing coverage, and if it's broken down by single, couple, or family, and also in terms of, I know there are former employees who can carry over their county coverage too. And I don't know if that number is a number that's very stable or if it varies significantly.
It's not very significant.
And it's a very small percentage of the total?
I think most people, when they leave, now we had that special situation where, 2011, where we provided that benefit. Taking that out of consideration, most people, when they leave, they are leaving to another employer. And now, because of the Affordable Care Act, where there are no pre-existing conditions, people are able to get coverage. Sometimes employers wait 90 days. So there may be a few months that someone may provide or take COBRA coverage, but it doesn't last very long, usually.
Well, I was curious in terms of, if we've got X number of county full-time employees, what percentage of them are taking advantage of the health coverage as opposed to, say, going on a spouse's plan. Obviously, most single employees, I presume, they all would. But if you're talking about family or spouse or couple coverage, I'm interested in if that number's stable or if that's varied at all. Do you have any information?
I think it's rather, I believe it's very stable. We have 2,556 employees that have our coverage. That's
this
a lot.
year?
Yeah.
And is that pretty?
It's been
about
pretty
the same?
consistent.
So a little over 2,500 employees with full-time employees with the health benefits.
Right.
Thank you.
You're welcome.
Any other questions from commissioners? Commissioner Norton?
Just a comment. I think we can spend a lot of time on health coverage, and it's not going to make a heck of a lot of difference in the cost savings one way or another. And Eileen brings a good point. If you go too far one way, you're incentivizing people to come to work here because insurance and benefits are important. Compensation's important also. I think the thing that will be a bigger cost driver if you look at the county budget will be what we do with compensation pools and all of that. We realized that probably 10 years ago, and that's why we started the conversation about pay for performance. Because if you give a COLA every year and then you have step and class adjustments, you can move the whole organization pretty fast to some pretty high levels and still not take care of that old problem that you have of treating everybody exactly the same and de-emphasizing the people that work harder, work smarter, listen to what their mission is, and take care of business, and de-incentivizing those that just want to ride the wagon with everybody else. And I think that's really important to big organizations to have that. It is not typical of governments to have a pay-for-performance system. And I think we really stepped outside the boundaries of what government usually looks like. We talk a lot, the world talks a lot about government looking a lot more like business. And certainly pay for performance is more of a business private model than it is a public model. But I think that's where you have the biggest emphasis. I think we need to look strongly at what Eileen talked about, which is giving enough compensation pool to start eliminating the compression. It's real hard to say we're going to give graduated increases and the graduation is from 1 to 3%. That doesn't make much of a difference. But if you go from 0, which would be a marginal employee, to like a 6% increase, then all of a sudden it incentivizes people to really do a good job, work hard, meet all their goals, all their key performance indicators, and really understand that. The difficulty you have sometimes, and I don't know if we've got there totally because I haven't been that involved with it, is tying the key performance indicators and the goals of each individual to their pay, so that as they get their rating, that's what dictates what their percent of the pool is. And I think we've worked pretty hard at that, but I don't know that we're 100% there yet.
And we're still working on that, for sure.
I think we need to put great emphasis on that. And I guarantee you, if you have a good career succession planning organization and the ability for high performers or any performer to know that if they work hard, meet their goals, stay focused on what their job is, that they'll get rewarded for it. And it also takes care of your marginal employees. Because if they get 0 raises for a couple of years, you don't have to tell them they're doing a bad job. They figure it out pretty darn quick and move on. And truthfully, that's who we want to move on. Mm-hmm. The low performers, not the high achievers.
Right.
So I'd say we need to work on looking at the compensation pool, understanding what that means, because payroll, we are a payroll-driven organization. I mean, we can talk about compensation, but the thing that hangs on us every year the most is payroll.
Service is what we do.
Yeah. That's all I have, Mr. Chair.
Hey, Bill, on our pay-for-performance pool, exactly how does that work? If we say we have a 3% pool, let's say, is everyone eligible for up to 3%, or does the department get 3% money and then they can distribute it however? So some people could get 5 or 6% and one.
We limit the upper level. So if it's a 3% pool, it may be 5 is the max. But yes, the department does that and evaluates the employees based on the process, and some people get 0 and some people get 5.
You get 5, okay.
Mr. Chair, one thing, and I didn't ask the question, but if you look at slide 11, I think, one of the things you can start to think about is a separate pay pool for exempt employees and a separate pay pool for non-exempt. So if you want to push the low-end folks, the hourly folks' wages up a little bit, you put a little more pool in theirs, which gets divided up, and a little less in your high-level exempt employees, which are your executives, your managers, your folks that are on salary, and that changes the dynamic. And you can do all those kinds of things. I mean, there was years at Target that the executives got their little bit of bonus, but they got no raise because of things. But they did put a pool together for hourly employees at certain level, most levels, so that you rewarded folks that came to work, did their jobs, but weren't in charge of creating profit numbers at all. But they worked hard and did well. And then the folks that suffered a little bit are the folks that didn't bring in the sales and operations numbers and profit numbers and things that make the company grow, and only then they could make those kind of decisions and work towards that. So, I mean, that's something to think about as you delineate that, push a little more pool to your hourly people and a little less to your executives. Now, you know, then you have to have an executive team that swallows hard and goes, I understand that. I'll go along with it this year. It's the right thing to do. I want the team to flourish. I want my employees to feel valued, and that I'll withdraw my increase or whatever this year, and it goes downhill a little bit. Those are all decisions we can kind of think about and push, but I would urge us to work on compensation a little more. We've already got a contract with United Healthcare through 17.
Mm-hmm.
We've got all of 16 to hash this out again and think about it and look at all the details, because whoever said there's a lot of moving parts is right. I can tell you, you get into a lot of sticky wickets when you're working on insurance plans or healthcare plans. And certainly the movement nationally now is to push money into prevention.
Yes.
So
100% covered.
So that people are staying healthier and your experience level doesn't go up. Because I tell you, wherever you work in the continuum of all those plans, the experience of your organization is going to change the dynamic. Maybe other than self-funded. But every place else, the experience level of who's sick and who goes to the hospital and
It definitely impacts us too, though.
yeah, it affects that system, but maybe more in some of the other plans. But it is the experience of your cohort group is what guides that.
Right.
It's not about the marketplace. It's not about other big organizations. It's not about a small business organization. It's about the 2,500 people that are in our pool. That's what guides the cost of our insurance. Nothing else. If everybody was healthy and never used it, the experience level would go way down, and at least for 1 year we'd have low rates until somebody else got sick and overused the system, and then it would go right back to a certain level. So that's all I have, Mr. Chair.
Also, one of the things I know that drove this is I think I made a request to modify our policy to include bonuses, which we can't do now. I'll continue to advocate for that. And you have this slide on page 28. I know it puts pay for performance bonuses way to the left, and I don't agree with that. I put it right next to pay for performance compounded, because the place that I came from before I was here, we had salary increases that were based on performance, and we had bonuses that were based on performance. And right now, we don't have the option to do bonuses, and there are some pluses and minuses there, but they're both based on performance. So I'd continue to advocate that we at least have that as an option.
The challenge with that is when we don't have people paid close enough to market. If you've got people paid at market, then bonuses work. But we've been using our pay for performance as a process to move people up towards market, which is why it takes 10 years to get someone to market when typically it would take 2 to 5. That's the challenge with
I
it.
understand, but there's other advantages, and it depends on.
Correct.
I think we should have the option.
Well, for people who have reached their maximum pay, they do just get a lump sum amount.
No,
so
I
we do that.
understand, but we need to have both of those in our policy, I believe. Commissioner Howell?
Thank you, Mr. Chairman. Just a quick question on new employees. When do they accrue sick leave, and how does that? Is it just over each pay period they earn a little bit of sick leave? Okay.
Yes.
Okay. And how much per year?
12 days. 12 days.
And that just accrues forever?
Yes.
And if they quit, they forfeit?
Except for if they retire and
If they're laid off or retire, then they get a portion of that?
if they retire.
If they are laid off, then what
No.
happens?
No. They're paid out vacation, but not sick leave.
Okay, so if someone was laid off and then they came back as an employee later on, would that account still be there for them, or that just zeroes out?
120 days.
120 days.
Okay.
That would be reinstated.
Okay, so then I was just doing some quick research. So the numbers I think that the chairman gave a minute ago. So individual can pay up to $33.50, and family can pay up to $66.50 for
Right.
an HSA. Now that's what they can. That's what they're able to contribute to their HSA. Is the employer limited?
Yes, the limit, whether it's employer or employee, is that maximum amount annually.
That's how much we can put in. That's it. Total.
Correct. Annually. I mean, every year you can put that amount in.
Right.
Right.
Is that combined together or separate?
Correct. Combined together.
So if we gave the 6,600 or whatever, the family couldn't do anything.
Correct.
Well, we are, but one of the plans you showed us, we could provide a catastrophic high deductible plan if we
Yes.
wanted to, and give them money for their HSA at the same time.
Yes.
Okay. In that case, we're providing an insurance policy, a health insurance policy for them.
Well, the way you put that, a high deductible plan, yes, but a catastrophic plan may not provide the right type of coverage according to the Affordable Care Act. We might have to pay a penalty if we didn't provide affordable care under that act.
In this case, though, they would be able to pay all their out-of-pocket expenses from the HSA. Right now, it's $2,000 each year. Zeroes out every January 1st, right? So
Correct.
for me and my family, the county's paying $15,285, it sounds like. That's the plan. Plus, I got to pay another $2,000, right? So it's $17,000.
Well, it depends because you are able to use co-pays. I mean, you're getting a benefit as you go along the year with your insurance.
So there are some well checks that are paid, things like that. But as far as anything I go to the doctor for, if I go to see a doctor on my toe hurts and I have him look at my toe, it's going to cost me $2,000 before insurance pays any of that money.
If you have a high deductible health savings account, yes.
I'm saying right now in the county.
No. If you, I have an example I could show, but if you have a problem with your toe and you go to your doctor, you're going to pay your up to your deductible, which would be $1,000 for you.
Right.
And then after that, you would go into coinsurance where you would pay 20% of the bill if it's in network.
I guess what I'm saying though is other than well checks, all the cost of my medical claims is paid by me until I hit my deductible.
No, sir. If you go to a doctor, you go because you've got a sore throat, you've got a tickle, you're going to pay a co-pay to go see the doctor. You're going to pay $20 to go see the doctor. If you go see a specialist, it could be $50 to go see the specialist.
Okay.
And that copay does not go into your deductible. You're paying that as the benefit of your health insurance.
Okay, so what happens at $1,000 for the individual? What happens at that point?
Once you've met your deductible, then you go into the 20/80 split. Like if you had to go into the hospital
Okay.
and you met your deductible of $1,000, after that $1,000, you would be paying only 20% of the bill.
All right, I'm sorry I'm new here. You might be asking some stupid questions here. I apologize to the room. One of the benefits of the HSA, again, my colleagues wanted to they said there was no benefit. Well, I would say that if you're lowering the out-of-pocket expenses, that's a benefit. There may be some advantages for the employee to have an HSA if it in fact lowers their out-of-pocket each year. And the way it would lower their out-of-pocket is if we're providing an insurance policy that covers things like hospitalizations, and overall the cost is less to the county, but we're putting money into an HSA, and they're paying more money out of the HSA for their care, but we're filling that up each year. We're putting money into the HSA. They pay, so their actual out-of-pocket expenses may be less each year, and any money left in the HSA would roll over each year. So there still may be some advantages. The other advantages, of course, is portability. If they go to a different job, plus it makes better choices when you have visibility of your healthcare costs. If you get sick on Saturday morning, right now you might go to the emergency room and see somebody expensive. Okay, on the weekend. Maybe you say, I'm not really that sick, I can wait till Monday. So you make better choices potentially, lowers the cost of health care, which is one of the advantages of having some visibility on what health care costs. The shared risk, you are shifting some liability towards the employee away from the employer, which is our advantage. Mm-hmm. So our 7% growth stops. And of course, money in the HSA can earn interest, and it's all tax-free. So any money they put in there is tax-sheltered money.
Right.
Those are some of the advantages.
Yes.
So there are reasons why we ought to be looking at this. And I'll stop there. Thank you very much.
A couple more questions. Health savings account. Who administers the health saving account, and then who pays
There,
it?
there's
There's be a fee for that.
There is
isn't
a fee for it, and
Where does that come out of?
United Healthcare, we would pay that fee. It'd be a part of our plan.
You don't have any idea
I don't know what
what
I
percentage
didn't
they
ask
use
what
on
an
it.
amount would be.
Yeah. Okay.
Let me say one more thing. My goal is not to be cheap, but to stop the growth. If I was going to say that we ought to be looking at this, it's to the hope that we could put more money into things like salary.
Right.
When you put it into things like overhead costs, I mean, these benefits, if you use them, they're great. If you don't use them, it's just overhead costs. And we can't probably put as much money into things like salary, which helps our retention if you're consuming money with things like benefits. So the benefits, if you use them, they're fantastic. If you don't use them, in a sense, it's a waste of money down the road. If you need it, great. If you don't need it, then I'd rather have the money in my salary, frankly. I think we would probably all agree on that. So the idea that we can shift money from benefits towards the salary, I think, is a good goal to have. It's not just to be cheap, but the 7% on a growing part of our benefits package, to me, is an alarming number, and I'd rather see us get a handle on that and hopefully put more of our attention on things like salary.
And that's one of the reasons why we are taking the approach that we are with trying to provide the education and the consumerism and incentivizing people to make those healthier choices and to help them understand what that costs them and us.
Thank you.
Thank you very much for the opportunity to present this information to you.
Is that it? I don't see any other questions.
I'll tell you some good news. The car tax was removed from the Senate tax bill on the floor amendment with 27 votes.
Good deal.
That's good news.
It's a good number, too.
We'll see.
We'll
It
see.
ain't over till it's over.
I was going to say, Dave, do you know the best place to go in the state of Kansas if you're going to die?
If I'm going to die,
Yeah.
I don't know where.
The State House. More things have been brought back to life in the State House than any other place in the state.
Nothing's ever dead at the State House.
Thanks, everybody.